Genitourinary syndrome of menopause, the old atrophic vaginitis, isn't just about dryness, it actually changes the physical structure of the female genitalia. I'm Dr. Kent DeLay, a board certified urologist in South Carolina, practicing in Indian Land and Lancaster. So let's talk about these structural changes in part two of this series. As estrogen levels drop, this leads to loss of blood flow or vascularity and thinning of the vaginal mucosa. Normally, the vaginal lining has what we call rugae, which are these kind of peaks and valleys in the tissue, which contribute to it being elastic and contributes to its lubrication. But these are lost once you enter genitourinary syndrome of menopause. These structural changes are important because they are often what lead to the discomfort with sexual activity. The clitoris is also affected. So the clitoris actually gets smaller, atrophies in response to the loss of estrogen and testosterone. This leads to loss of sensation, and actually the little bit of tissue over the clitoris called the clitoral hood can actually fuse down onto the clitoris and can cause loss of sensation and pain as well. The labia and the vestibule, which is the opening area, also contract and become less sensitive. And because of this contraction and loss of elasticity, this also contributes to the pain with intercourse and makes the tissues more susceptible to trauma. And that thinning of the vaginal mucosa we mentioned actually makes it easier for bad bacteria to stick, leading to an increased risk of urinary tract infections. So GSM, or genitourinary syndrome of menopause, is remodeling of the tissues in a bad way. And next time we're going to talk about what some of the treatments are for these anatomic changes.